Welcome to Adapt NCLEX. This is the third version, the 85 questions, comprehensive review. This is from Adapt NCLEX to you. And this is the last one. It's a review to help you direct your learning, to pay attention to areas, concepts that you have to know, topics you have to know for your exams. Questions are up-tempo. You get harder and harder and harder. I start with the hard ones and I sprinkle easy ones in it, but they are very, very tough questions. If you're getting them done, you're golden. I suggest that you pause the video, answer the question, unpause it, and listen to the way I approach it. 85 question, very quick one, but I'll give you the key fact, the concept for each questions that you need to know. Stick around and all the best of luck. Test taking strategy will be discussed also. First case, selected and apply. Most of the cases are all selected apply, intentionally designed to bring your content. You pick those that you know you're confident about. Don't choose if you don't know. Leave it behind. Which of the following actions by the nurse is appropriate? Buzzword, action, and appropriate. The client presents to the emergency room with fever, cough, runny nose. COVID-19 swab was positive. Which of this is appropriate? Buzzword, simple way. I have COVID-19, positive. What action would the nurse do? You have to know. We've seen this before. COVID, we've gone through it before. What is the precaution? You need a contact precaution and an airborne. So it's an airborne, as you already know, and then it has some contact precaution associated with it. So this is two issues. Therefore, airborne, correct. Contact, correct. Now, nurse wear N95 masks during care, yet because it's airborne. Client in negative pressure room because it's airborne. Nurse remove the gown and the gloves in the side room. That means he or she move out of the patient room and go to the side room where they usually change their stuff. No, you should remove the gown and the gloves because it's a contact in the patient room, because you touch the patient. If you move it out, you're contaminating the other room. So this is wrong. Client wears surgical mask for CT scan. Yeah, if they're getting out of the building, this is classic for airborne. If you are in an airborne precaution like negative pressure and you go into a CT scan, you just wear a surgical mask. So this is appropriate. 5 is not appropriate. 1, 2, 3, 4, and 6 are appropriate. First question, done. Number 2. 4 clients in the med-surg unit. Client A, sickle cell and enlarged spleen. Client B, mononucleosis and abdominal pain. Client C, tonsillectomy and excessive clearing of the throat. Client 4, pelvic surgery, right calf edema, and pain. Which client is a priority? You have to be sharp. How do you be sharp? You take care of the things that will cure the patient. Number 1, sickle cell and enlarged spleen is somebody who is bleeding. They should not have a large spleen. Your spleen should be smaller. If his spleen is enlarged, it's called splenic sequestration. This will rupture and it will bleed. It's a priority patient because they will bleed. B, mononucleosis patient with abdominal pain means their spleen or liver is enlarged. They are about to rupture. And that is also classified as bleeding. You are being sharp. Tonsillectomy with excessive clearing of your throat. The tonsil is embedded in the vascular area. When you remove it, they bleed. And when they bleed, they'll clear their throat to remove the blood. This patient is bleeding. Guess what? Last patient. Pelvic surgery and a right calf edema and pain. Even if you don't know, test taking strategy. 1, 2, 3 are all bleeding. Who should be the bad bleeding? There's no bad bleeding. If you're bleeding, we are bleeding, right? But D should be your right answer because you have 3 bad bleeding. So therefore, I have to put in D. D has to be something else. Pelvic surgery and right calf edema and pain. You operate in the pelvics, all of a sudden they have calf edema and pain. Guess what? This patient has DVT. If you have DVT, you can get pulmonary embolism. This become a breathing problem. Therefore, priority patient is number 4. Number 3. Straightforward question, right? Select or apply. Which of the following the nurse should include in the teaching? A nurse is providing teaching to a female client with a new diagnosis of Sjogren Syndrome. What do you think? Sjogren Syndrome. Or sometimes we call it Sjogren Syndrome. So Sjogren Syndrome. What do you think? You have to understand this diagnosis and be able to figure out what it is. Sjogren Syndrome. Teaching you have to provide. This is all content. This is an autoimmune disease where you make all glands that secrete secretion to lubricate things are all dry. Physically, every glands that affect secretion usually are affected, like the glands in your mouth. So your mouth are dry, your vagina is dry, secretion, your semen will be dry. Your eyes, when you cry, is really dry. So those people, they get into trouble. So they have dry eyes, dry mouth, dry vagina, and it's a problem. So you have to teach them. It's an autoimmune disease. Therefore, which teaching is appropriate? Look at it. KYGL for sex. Yes, to lubricate. Artificial tears to lubricate your eyes. You have to lubricate your skin. Mild soap for bathing. Okay. You take sugar-free gum to lubricate your mouth. Caffeine is bad. In your exams, caffeine, alcohol, tobacco, antacid, never choose them. These 4 things, never choose them. Caffeine, okay, tobacco, alcohol, antacids, grape, fruit juice, they are all bad stuff. So why would you want to choose this for a patient who is always drying and things are dry already? Don't pick it. Ophthalmology visit every 6 months. Yes, to look at your dry eyes because the eyes is dry, they scratch their cornea most of the time. Therefore, they need an opto visit. So this is good for Sjogren disease. You have to know this concept, and that's what I've given it to you. Number 3 is down. Number 4. This one is just straightforward. It's all content. Which oxygen delivery device is appropriate for COPD clients who need precise amount of oxygen concentration? The keyword, buzzword is precise amount. All of this give you a certain percentage of oxygen, but there's one we use for COPD, specific, give them precise oxygen. It's a ventral max, okay? This is nasal cannula, if you can look at it. This is usually used for everybody, comfort, you can eat with it. This is a regular face mask, okay? It's easy, but you have to take it off before you can eat. Non-rebreather, that's the one that always have a chin. He has a mustache associated with that. Air going into the bag, and the bag has to flow and be distended before you can get appropriate amount of oxygen. If it's not distended, you don't get the right amount. So that is non-rebreather. This is the ventral mass. So this is your right answer. This is what you give it to COPD. It's used for COPD patient who need certain amount of oxygen. Non-rebreather is used in emergency. Precise amount is the key. So this is what the patient need to wear. This is just straightforward. It's content you have to know. And the buzzword is precise. Question 5. This is a content question. You just have to know this. The reading below was obtained, right? What is the next best action by the school nurse? The next best action. The client with what? Asthma present to the school nurse with wheezing. Rewrite it. Patient with asthma went to the school nurse with wheezing, and the reading below was obtained. This is the reading below. This is the green zone. This is the yellow zone, and this is the red zone. The green zone is greater than 80%. The yellow zone, 79 and to 50. The red zone, greater, less than 50, basically. So if you are in the yellow zone, that means what? There's something you have to know. You have to know these zones because they can ask you red, yellow, and green. Yellow zone means you're doing okay, but we need a modification of your medication. So this patient came to the school nurse wheezing, okay? So what would you do? Would you send the client back to the school classroom? No. Send client to the emergency room. You send client to the emergency room if they are in the red zone. So no. Give 2 puffs of albuterol and inform client mother on medication adjustment. Yeah. So the client will get 2 puffs and they tell the mother that I need to go see the doctor to adjust medication. Reassess the client later. No, you got to fix the problem. So the yellow zone is usually give them a puffs and then figure out what is going on later on. And so that we can modify the medication. Number 6. And nurse is reviewing types of dehydration based on the sodium level. The nurse knows that this type of dehydration leads to balanced loss of water and electrolyte. I intentionally said this to confuse you, frustrate you. It's all language problem. And the nurse knows that this type of dehydration leads to what? There's a balanced loss of what? Water and electrolyte. In dehydration, you're either losing water or electrolyte. Okay? Which type of dehydration you lose a balance, the same amount of water and electrolyte. In hypertonic dehydration, it's not. You don't losing the same, right? In hypertonic dehydration, you're losing mostly water. You're losing your water and you get concentrated in your blood. So in hypotonic, you're losing mostly electrolyte. And so your blood become hypotonic. In isotonic, you lose the same water and electrolyte at the same time. There's nothing like hypotonic, isotonic. I made it up. So this you have to know. It's a language problem, but it's a test-taking skills. You just have to figure out. And that's the quick one I put in there to relax you, but you still have to think together. Yes, this one, you see, hard one. Look at it. You may know it, but I intentionally frustrate you with a bunch of images. This is what the test about. The test can be to, you got to get yourself prepared like that. Select four. I said 4, SATA. 4 findings that need follow-up. What is the problem? A client presents to the emergency room with what? Fever, chills, night sweats, productive cough after 1 week of business trip to South America. Buzzwords. You should figure out right now that this is a problem. This is not something you should let it go. All these words over there after 1 week, this is classic. Past medical history, none. Past surgical history, none. Medication, none. Is febrile, heart rate 80, blood pressure is this, respiratory rate of this, and SAT is that. Chest X-ray, look at what it shows. Patchy opacity of the upper lobe and the middle lobe, and bilateral hilar lymphadenopathy. Summarize it. I went to business trip 1 week, all of a sudden, fever, chills, night sweats, productive cough. I have bilateral hilar adenopathy and right upper lobe and middle lobe opacity, and I have fever. What do you think? In South America? No brainer. This is classic tuberculosis, right? TB. So which finding need follow-up? Yeah, your fever, I don't like it. Your chest X-ray, I don't like it. Okay, your blood pressure look okay. Your saturation is not good, 94 in room air. And you have chills, yeah, I don't like it. Your heart rate look fine. So this is 1, 3, 4, 5 are those that need follow-up. But this is classic tuberculosis. This is the way they will said it. I didn't want to give you a full case right now. I just made it this for you, right? Good. Same patient. We already make the diagnosis, right? So what is the next anticipated diagnosis? So this is the full case. It's a full case. That's the initial case. This is the second case. The same thing. A client presents to the emergency room. The same thing. So what is your diagnosis right now? Buzzwords: fever, chills, night stress, productive cough, fever, patchy infiltrate in the right lower lobe, middle lobe. This is not lymphoma. This is there to confuse you. Highlight lymphadenopathy. You don't develop lymphoma just by going to South America, right? Usually, okay, you lose weight and it happens for several, a couple of months, right? This patient has active TB. This patient has no lung cancer. Lung cancer does not give you fever. This pneumonia is very deceiving, but this is not classic pneumonia, because he has so many signs and symptoms that somebody would think this is just pneumonia. But TB, this is an active TB infection. It's because of the location, okay, of the PASI, the specific patchy opacity of the upper lobe and the middle lobe. And the bilateral hilar adenopathy is classic for TB. So that is, and you have to put everything together. So this is active tuberculosis. So we know this is active TB, right? Then what? Same thing. Which of the following is indicated? If we know the patient is in active TB, well, airborne precaution is what we need. We need to put the patient in an airborne precaution, right? Airborne precaution, no brainer. Private room with negative pressure. Excellent, right? Clients wear N95 in their room. No, they don't wear anything in their room. Nurse wear gown and gloves during routine care. It's airborne. You don't need, that's for contact. It's not a contact precaution. You need to get a sputum culture to be able to make a diagnosis. And so 1, 2, 5 is your right answer to be able to figure out. So that's what is what indicated. 3 and 4 are not indicated. Same question. PPD was positive. Now we know that the PPD was positive. The nurse received an order for sputum culture. Which of the following action by the nurse is appropriate? How do you obtain sputum culture? You have to know its content. It's usually you go and get it in the morning, early morning. Let the patient brush their teeth and then take 3 sputum. Okay, 3 separate sputums. Okay, different consecutive times. Obtain midday sputum, no, negative. Obtain night time, no. Early medium sputum times 3. Yes, that is the way to get your proper specimen for analysis. So morning sputum, early morning sputum is the best way to obtain culture for TB. Now, same patient, right? The client was diagnosed with active TB as well. Started on quadruple therapy, so isoniazid, rifampin, pyrocinamide, intabitol. These are medications that are used for TB. Patient present to the emergency room what? 1 month later with what? Flapping tremor. This is like, I just want to kill you, with like confuse you, try to like get worried. What am I doing? I'm trying to get you think. Now we give you what? Flapping tremor, lethargy, scleral icterate, and severe pruritus. I'm switching gears. You have TB, we give you TB medication, you come in with the flapping tremor, you have lethargic, you yellow, and you have pruritus all over. What do you think? This is encephalopathy. The patient is in severe liver disease. Now is encephalopathic. What do you do with the liver disease with encephalopathy? This patient needs to be in the ICU. You give them lactulose, but look at it. Don't just look at lactulose and move. With food, no. You only give them with milk, okay? Or empty stomach. So, no. Neuro checks, yes. You check the ammonium level. Yes. Titrate lactulose to 4 bar movement. Wrong. Lactulose can only be titrated to 2 to 3 bar movement. So this is not indicated. So those are the answers. This is the question I intentionally did it to like text you. Okay, number 12. We're still going. It's a 6-step question type. Patient is ready for discharge. Which of the following teaching by the nurse is appropriate? Select or apply. You're ready to be discharged. What would you do? Take vitamin B6 to avoid peripheral neuropathy. No. When you're taking isoniazid, you don't take vitamin B1, sorry. You take vitamin B6. So this is wrong. You don't take vitamin B1 is wrong. You take vitamin B6. Need ophthalmology appointment in 6 months. Yes, this is for Entabitol. When you're taking Entabitol, that's what you do. Drink 2 to 3 liters of water to avoid gout. Yes, this is when you take the paroxysmide. That's the one to avoid gout. Call immediately with orange yellow urine. No, you don't call. This is for rifampin. Orange yellow urine is normal when you're on rifampin. Minimize alcohol intake. That is a trap. You don't need to minimize. You should completely avoid alcohol when you're on TB medication and you have liver injury. So this is wrong. So which one teaching is appropriate? 2 and 3 the right teaching that is appropriate. Okay, number 13. Which assignment from the RN, we finish with the case, to the UAP, should the UAP clarify? Assignment, right? Which one would the UAP clarify? Select or apply. Okay, so you have to know the function of the UAP. I always say UAP does things that does not require thinking. There's no thinking at all. They observe, they can record. They observe, they can tell you, but they don't have to do assessment, think about it. Report skin breakdown during tanning. Yeah, if I tell a patient skin breakdown, I don't tell you the quality. I'm not describing what it is. I say, oh, there's a skin breakdown there. Go look at it and assess. Yes, so there's no need to clarify this. So this is fine, right? 10 client Q4. They just tend them. There's no need clarification. They can do this. Report choking during feeding. When the patient is eating and they're choking, you can say, hey, he's choking. You're not making an assessment. Okay? Assist client with choking. When the client is choking, you can provide emergency maneuver. They've been taught to do that. So that's why they can do CPR, right? Assess client respiration during feeding. Keyword assess. They cannot assess. So this is odd one. Report heart rate of greater than 100 immediately. If they check the vitals and the heart rate is greater than 100, yeah, they can report what they see. So I don't need to clarify. It should not clarify that. Document saturation in electronic medical record. They can document what they have. They have places where they can document their report. So they are allowed to report in the medical record. So this is it. So there's only one answer choice. Select or apply in this new generation. Place, you pick those that you think you're confident on. If you're not, leave it. There's only one answer. If you pick more than one, you get 0 for this question. Intentionally said it that way. So clarification, it's only one. Number 14. The nurse is orientation of new graduates to the med-surg unit. Both nurses are caring for a new client with diagnosis of what? DVT, requiring an enoxaparin injection. Which action by the new graduate require immediate intervention by the nurse? And I give you a BMI of 40. This is a critical thinking question, test taking skills. I did not write it the way you usually see it. I put it in this form to distract you. All I'm saying is a nurse is teaching somebody, a new graduate, who's going to give a patient with enoxaparin, right? That is heparin, sub-Q heparin, right? Different type of heparin. But the patient BMI is 40, is key. Take patient. There's a way you inject it. Inject 2 centimeters from the umbilicus, correct? But do you inject intradermally? No. Sub-Q. It's a sub-Q. I need to intervene. Needle angle 45. If the patient, you can pinch more than 2 centimeters, you don't need to inject it at 45. The patient is thick, obese patient, you can pinch fat more than 2 centimeters. Therefore, this we need to intervene. Massage the site, you need to intervene. You don't need to massage the area. Then the needle angle at 90, yeah, obese patient, since you can pinch more than 2 centimeters, you inject the low venous at 90 degrees. So there's no intervention, but this one, we have to intervene. So first, second, third, need to intervene. Hard question, sorry. The same strategy, right? Now you get the point now. Simple question, but I put in this form to distract you. Which of the following actions are indicated or not indicated by the nurse? A client presents to the emergency room with what? Buzzword. Fever, fatigue, arthralgia, flu-like symptoms after camping, right? Client was diagnosed with what? West Nile virus infection. Oh, I'm telling you, you have West Nile virus infection. Which of the following actions are indicated, not indicated by the nurse? This is a trap question. Everybody thinks this is a big problem. It's not. It does not affect you, the nurse, the hospital, anything. The person in trouble is the patient, the client. What is this? West Nile virus? It's an infection caused by mosquito, and is the mosquito that is involved in the transmission of the disease. What is the problem? This is a standard precaution. You take care of the patient as if it's any other patient. There is no infection associated with you or anything like that. So treat the patient. Acetaminophen for the fever. Give them IV fluid. They have flu-like symptoms. Negative pressure room, no. They have no infection to transmit it to anybody. N95 masks for the nurse, no. You don't wear anything. Surgical mask for the client, no. It does not wear anything. This is a standard precaution. You don't need anything unless they have a wound you're taking care of. Yeah, you institute a contact. But taking care of a West Nile virus patient, it's just a standard precaution. Next question. An asthma patient on chronic steroid. The same strategy I'm trying to let you think. These are the single short cases they always give you. So that's why I'm trying to get you there. Present to the emergency room with what? Nausea, abdominal pain, systolic blood pressure of 80. Client was camping for 1 week and forget to take what? Buzzword, steroids. There's no zinc contact. Nobody's sick that they get in touch, and he has no diarrhea, no dehydration. Which of the following is indicated or not indicated? Sit back, relax, figure out the problem. An asthma patient who is on chronic steroid and has stopped taking steroid for a week, what do you think? When you are an asthma patient and you take steroid, you are becoming Cushing patient. When you stop taking your steroid, you become Addison. So this patient is in Addison crisis. That's why systolic blood pressure is low. It has abdominal pain, nausea, all the signs and symptoms of Addison crisis. What do you do? This is a good question to make you think. Insulin drip. Guess what? When you are Addison patient, their glucose is low. Their potassium is high. Their sodium is low. This is key. This is all the management for Addison patient. Their glucose is low. If you give them insulin drip, you're killing them. Their glucose will drop. So not indicated. Give them IV fluid, hypotension. Give them steroid, fludrocortisone, that's steroid. Medical surgical ward. No, this patient will go in shock, need to go to ICU. D5W infusion. Yeah, give them some sugar. Okay, they need some sugar. So this is what is indicated and this is what not indicated. But this is a good endocrine case to get you thinking. Number 17. Guess what? Straightforward, right? Which of these clients need interdisciplinary team referral? That's all. You have 4 clients who need that. The one that need it is somebody who had one problem that need multiple subspecialty to help take care of this patient. 24-year-old with acute appendicitis, no, it does not need that. You have pneumonia, no. 60 fibrosis, yes. You have the pulmonologist. You have social worker taking care of it. You have a physical therapy taking care of it. You have the nutritionist. Everybody is involved. Somebody with migraine, no, you just don't need a bunch of people taking care of. So if there's a cystic fibrosis, it's that patient. Number 18. This is a pharmacology question. Select or apply. A female client with severe acne was prescribed tetracycline. What teaching the nurse should provide based on the prescribed medication? You have to know it. If you don't know, you don't pick the answer. If you're taking the red test. But if you know what tetracycline is, the side effect, yeah, pick it. Even if you don't know, look at the answer choices. There's some easy ones there that you can pick, right? Which teaching you think should be included? Tetracycline, use barrier method for birth control. Yes, it decreases oral contraception effectiveness. So you need condom in addition to that. Take medication with food. No. This drug, you take it with empty stomach. You don't take it with anything, empty stomach. But you take it in the morning. This is one I set to show you you have one portion of the answer choice right, the answer choice is wrong. So you may know that you should take it in the morning, but you should not take it with food. So because there is food here, it's wrong, even though taking it in the morning is right. So this is wrong. You take it in the morning because it causes esophagitis so that you can be up all day. And if you go take it in the evening and you lay down, you get esophagitis. But you don't take it with food. You just take, if you have to take with food, you want to eat, you take it 1 hour before food, okay, or 2 hours after food. Take medication with iron supplement. No, iron affect absorption of that. Take medication with antacid. I told you already, don't pick antacid. Remain upright for 30 minutes after taking medication. Yeah, it causes esophagitis. So you have to remain upright. And then you have to take a lot of water, 8 ounces of water to avoid esophagitis. It's a photosensitivity, give you some photosensitivity. So you got to have a sunblock. So 1, 5, 6, 7 are your answer choice. But this is tetracycline. Number 19. What do you think? Select or apply. At discharge, which statement by the nurse need immediate intervention by the nurse, right? Intervention. We need to intervene. A nurse is caring for a client with new diagnosis of acute mania, okay? And is stabilized on lithium. So you're taking lithium. What are the things that I need to worry about, that I need to intervene, that you said that is bad? Stay on low sodium diet. No. When you're on lithium, you stay on normal sodium diet. You don't go low, you don't go high. Initiate high sodium, like I said. You don't go high, you don't go low. Acetaminophen, you want to avoid NSAID. Acetaminophen is good. Change hydrochlorothiazide to what? ACE inhibitor. It's the same thing. You want to avoid diuretic and you also want to avoid anything that will lower your sodium. So when you change from hydrochlorothiazide to ACE inhibitor, it's the same thing. You're going to be in trouble anyway. You want to avoid ACE inhibitor and hydrochlorothiazide. So this is wrong. Drink 1 liter of water a day. It's not enough because lithium causes nephrogenic diabetes insipidus. You want to drink at least 2 to 3 liters of water a day to avoid dehydration. So this also not good. So 19, what do you think? What need intervention? 1, 2, 4, and 5. So 1, 2, 4, and 5 are those that you need to intervene. This is fine. We don't need to intervene. And so the question asks immediate intervention. That one. 1, 2, 4, and 5 are your wrong answers. So those are the right one you got to pick. They need immediate intervention. 3 does not need intervention. Number 20, same strategy, okay? What do you see here? Number 20, what do you see? Select all that apply, right? And this is assessing a 28-month-old baby at the ped clinic. Stroking of the undersurface of the foot shows fanning of the toes and dorsiflexion of the big toe. Big words. I have a 28-month-old. I fan the undersurface. No, I touch the undersurface and the toe fans and there's the dorsiflexion of the big toe. This is just Babinski. That's what I'm describing. Babinski. You should remember the fanning. That's the buzzword. What is the problem with this? The kid, you have to use test-taking strategy. 2 years old, and Babinski is still there. No, the Babinski shouldn't be there. No, 2 years old, we should be worried that they're showing signs of Babinski. These are early childhood, like moral reflexes and all. These are things that usually goes away. So if 2 months old is still there, we have a problem. Okay, we have a problem. So record this normal finding. No. Recommend CT scan of the abdomen. No. Recommend evaluation of cerebral palsy. Yes. If you see that it has not gone away, yeah, we worry. Refer to orthopedic for orthotics. No. Notify the doctor. Yes. So 3 and 5 are your right answer. You got to recommend for cerebral palsy. And Nance is caring for a client, a myasthenia gravis client who was given physiostigmine in the morning due to what? Excessive dysarthria. 4 hours later, the nurse observed what? Excessive salivation and heart rate of 50. What is the suspected diagnosis? 2 actions to take and monitor by the nurse. You have to break it down. Myasthenia gravis patient, right? We give them physiostigmine so that we can increase their what? Acetylcholine, so that they can function well. Then 4 hours later, we see excessive salivation and bradycardia. What do you think? If I give you too much acetylcholine, this is what you have. So this patient is in a situation where we're giving them too much of acetylcholine. Therefore, it's not myasthenia gravis. It's not Addison, it's not dehydration, it's in cholinergic crisis. If you're in cholinergic crisis, what would you do? Block the cholinergic. So how do we block acetylcholine? We don't add another medication, neostigmine. We're not going to increase physiostigmine. All this is increasing acetylcholine. We want to decrease it, right? We give them atropine to block it. Anticholinergic. Galantamine is also an anticholinergic. It's an antidote you can use. And this will block acetylcholine. If you block in acetylcholine, you make them anticholinergic, right? That's what you're doing. Anticholinergic effect is tachycardia and pupillary dilation. Brady, no. And what? Diarrhea, no. Brady is cholinergic effect. Diarrhea is cholinergic effect. So we have a diagnosis of cholinergic crisis. We give them atropine and galantamine, and we monitor for tachycardia and pupillary dilation. This is a both type question. This is another case. Very interesting case. But you have to watch it. What diagnosis the nurse should expect? It's like a 6-case form. You should stick around for this if you're trying to leave. This is your boy. The client was admitted for uncontrolled hypertension. Client drank 4 to 5 beers a day. No other past medical history, no tobacco, no allergy. It's on hydrochlorothiazide, but has been non-compliant. Last alcohol intake, pay attention, 12 hours ago. Vitals, temperature is fine, slightly tachycardia, blood pressure is too high, satisfied. The blood pressure was controlled with nifedipine. Now it's controlled. 48 hours in the hospital. We have a fever, hypertensive again, tachycardia, is drenched in sweat, is restless, tremor, palpitation. They will give you this. That's what I'm giving you all in the short form. Okay, they will sprinkle it. I'm giving you. Sees a cat on the wall. What is this? Hallucination. What is your diagnosis? Somebody who's drinking every day, 4 to 5 beers a day. The last time he came to the hospital was 12 hours ago when he had some drink. Now 48 hours, he's seeing some cat on the wall. He has palpitation, tremor, restless, drenching sweat, and he's tachy and febrile. This is not hypertensive urgency. We already control the blood pressure. This is not just hallucination. They're seeing other things too. This is delirium tremor. It's not just mild alcohol withdrawal. With hallucination and restlessness and tremor, they pass mild alcohol withdrawal. It's more than 48 hours. So they are not in mild alcohol withdrawal. This patient is in full-blown DT. So delirium tremor. Now, which of the following intervention is indicated? The same patient. What do? You have to know how to manage patient in DT. You have to know. You have to give them something to prevent seizure. So you give them benzodiazepine. So chlordiazepine, that's benzos or Valium, whatever your diazepam, you can give them lorazepam. It's the same thing, but this is what I give you. This says you have to recognize it's a benzodiazepine. Replace glucose. Replace glucose before timing. This is always a trap. When somebody is always alcoholic, their timing level is low. Timing is used to metabolize glucose. You need timing to metabolize glucose. So if the timing is low and you give them glucose, this will chew all the timing and they will get Wernicke encephalopathy. So this is the Wernicke you see of alcohol. So therefore, you should not replace the glucose before timing. You replace timing before glucose. So this is not indicated. Replace folic acid. Yeah, their folic acid is low. They need hydration. Their magnesium is also low. You don't keep this patient in med-surg. This patient go to ICU or step down and initiate a CWAR protocol. So 1, 3, 4, 5, and 7 are what is indicated. This is classic alcohol withdrawal, a good board question. The client was ready for discharge and was prescribed medication to minimize, this is pharmacology, minimize alcohol craving and pleasurable effect. Which drug would you use? Which of these drugs minimize alcohol craving and pleasurable effect? Methadone is opiate. We don't use in alcohol, right? Naloxone is what? Antidote for opiate. Test-taking skills. Disulfiram, it does not minimize alcohol craving. It makes it worse. It is anti-abuse. That means if you take it, you get sick. It does not minimize your craving or your pleasurable. The thing that do that is nitrogen. You have to know the difference. Disulfiram is the one you use to prevent them from drinking. If they're drinking, they get sick. They can die from it. So the one that minimizes the craving is the nitrogen. The nurse receive an order for seizure precaution. Now we know the patient is going to be in seizure. Which of the following are indicated? What do you do for a patient who is going to seizures? You think they will get into seizure? Client lay supine. No. Let them lay on their side so that when they vomit, when they're having seizure, they vomit, they won't aspirate. So don't put them supine. They have to lay on their side. So this is not indicate. One side rail up. No, both side rail. This patient, this is not restrained. This patient is going to go into seizure. Suction at bedside. Yes. Tight feeding. No. Take all loose feeding so that when they go into seizures, you cannot choke them. Bed at the lowest position. Excellent. And give the patient privacy. So 3, 5, and 6 are your right answer. Same patient, right? The client was prescribed now, this is the medication I told you, disulfiram, just to give you all the content at discharge. Which of these are the priority to include at discharge? This is the medication that can kill them. So consent for the medication. Yeah, I'm giving you a drug that when you drink, you get sick. Side effect of the medication, you have to include at discharge. List of all possible. There is certain things that has alcohol in it. They will think they're not drinking, but they will take aftershave and they will use it. That will absorb alcohol in their body and they get sick. Or they use hand sanitizers that has alcohol in it. So provide them a list of anything that should contain alcohol. Refer them to Alcohol Anonymous meetings so that they can take care of them and identify stresses. Why are they drinking? So that we can fix their problem. So always this one is indicated. So that case is over. Like I told you, this case questions are hard. Sorry, that is the way it's supposed to be while you're learning. Which of the following action indicate correct understanding of the ABG by the nurse? The client is receiving assist control ventilation for surgery. After surgery, ABG 7.4, PCO2 41, bicarb what? 34, and saturation 90. I have ABG 7.5. This is what? Alkalosis. What is contributing? Bicarb is too high. So this is bicarb is metabolic problem. So I have a metabolic alkalosis. How do you control this? Alkalosis become what? Acidosis. And metabolic become what? Respiratory. Therefore, I need to do what? Respiratory acidosis to fix this problem. Because the patient is on the ventilator, you obtain this lab work. Which action would you take? You look at the ABG and say, oh, this patient is a metabolic alkalosis. I need to correct it. It's not normal. I need to bring it down to a normal ABG. To do that, you have to initiate respiratory acidosis. Which of this is respiratory acidosis? To increase the CO2 is all about rate, the rate of the ventilator and the volume. It does not affect FiO2. FiO2 affects saturation. PEEP affects saturation. Stop the sedation. They're going to wake up and breathe really fast. They will blow their CO2. They will make them more alkalotic. It gets worse. Decrease your respiration rate will make them, the CO2 goes up and they will develop respiratory acidosis and that will fix the problem. Hard question, sorry. At discharge, which referral should the nurse recommend to assist the client with activities of daily living? What is the problem? This is interdisciplinary team. A nurse is caring for a client with left forearm. The forearm has traumatic amputation after motor vehicle. So he has lost his left forearm. He got to dress, he got to do his routine, activity of daily living, right? Who are you going to check? Does not need a physical therapy. There's no walking with that. He has to dress himself. Respiratory therapist is not involved. Case manager is not involved. Occupational therapy is the one that help with the activity of daily living, using your hands and other things to dress yourself, take care of yourself. Physical therapy, like using crutches, yeah, you have to use physical therapy, but occupational therapy is one indicated for activities of daily living. 54-year-old client prescribed what? Digoxin and dabigatran for AFib. Sit back, don't worry about it. AFib, I have AFib, buzzwords, digoxin, and what? Dabigatran. What do you think? Every answer choice, look at it and see if it matches with this. This is an anticoagulation, and this is what you're controlling the rate. Check a pause for 1 minute before taking the digoxin. Yes, you got to take your pause for one more, apical pause for a full minute. Avoid green leafy vegetables. You don't need diet modification for dagatoband. Take salt substitute. Think this is a test taking scale. Salt substitute contain too much potassium. When you're on digoxin, I want your potassium to be normal. Don't increase it. Don't decrease it. If you take too much substitute, you increase it. That's wrong. Avoid local rise. Local rise, what is that? It decreases your potassium. I told you potassium should be normal. Avoid anything that will decrease your potassium. Excellent. Need frequent lab draw. That's for the digoxin. Need PT INR. This is a trap. Dabigatran does not need any lab work. It's not Coumadin, so you don't need that. So the right answer is 1, 4, 5 are your right answer. Number 30. A nurse is caring for a new client admitted for what? Left pneumothorax. Left tube thoracotomy was placed immediately. You place check chest tube. Select 2 priority items the nurse must have at bedside. This is all content. Anybody who have chest tube at bedside because of accidental pulling, because of the tube coming out, oxygen is not that important. Most of them don't need it. The must one you should have is 250 ml of sterile water and antiseptic wipes because you may need it. Stethoscope is not necessary. This and this is related to the tube falling off and figure out what you need to do and or the tube damaging. As soon as possible, you need to have them at the bedside to fix problem as soon as possible. So 2 and 3 are your things you must have. Guess what? Classic psych question. Classic psych question. Which finding will be classified as negative symptoms? Negative symptoms. Negative symptoms. A schizophrenic client was admitted involuntarily due to inability to take care of himself. The nurse observed the following assessment. Which one are negative symptoms? Negative. There's hallucination is a positive symptom, so it's not. Disorganized thought is not. Delusion is not. Positive symptoms are symptoms that diagnose mostly schizophrenic, and they're usually upper symptoms. That is the way I call them. So hallucination, disorganized thought, and delusions, they are upper symptoms, though they are not negative symptoms. Flagged affect, excellent, upper. Evolution, I'm not going to tell you what it is because the next one, answer question is over there so that I don't give the answer away. And idonia, yes, these are pressurable things that you worry about. Yeah, all these are signs of negative. They are going down. The sound like it's going down. So these are negative symptoms. Select or apply. Which of the following the nurse should anticipate during assessment? A client with type 1 diabetes present to the emergency room in DKA. What do you expect in DKA? These are things they will ask you. I'm trying to get you focused. You're in DKA type 1 diabetes, you're going to have ketones. When you have ketones, you smell fruity. So You're going to have Cushman breathing, rapid, deep respiration to get away, to control the what? Metabolic acidosis into respiratory alkalosis. So they will have this. That's what they're trying to compensate. Their glucose usually doesn't go close to 700. Sometimes 250, they get sick. 700, you're talking about HHS. So this is not. Their pH is going to be acidotic. Why would 7.6 be anacidotic? So I'm not taking it. It should be less than 7.4. Dry mucous memory. Yeah, they dehydrated and they will have abdominal pain. So these 1, 2, and 5 and 6 are your answers. DKA symptoms. This is also taking skills. Which clients should be most prioritized for intracranial monitoring and monitor? And this is carrying your 4 clients in a neurosurgery ward. What this is, rewrite it, these buzzwords: intracranial monitoring and monitor. I'm going to measure your ICP and I'm going to give you monitor. That means you're sick. Your ICP, your GCS is low, calculated. This is not that low. This is not that low. This guy is low, right? This guy is 15. This guy is 14. And this guy 8. This is 13. And this is what? 9. Well, 9 guy is in trouble. So I want to monitor this guy. This is another question you have to think. Which of the following the nurse should anticipate on assessment? Pay attention. A client arrived to the emergency room via ambulance after stabbing to the left chest. Stab him on the left chest. Echocardiogram show fluid in the pericardium. There's fluid in the pericardium, the fluid around the heart. Client developed complication in the emergency room due to the amount of fluid in the pericardium. Does it make sense? This is your heart. It's being surrounded by fluid. It's not supposed to be there. And you develop complication. What will happen if you have fluid in your pericardium and you develop complication? This is what we call cardiac tamponade. You push on your heart and you develop cardiac tamponade. What are the signs and symptoms of cardiac tamponade? That's what the question is asking you. Question analysis and rewriting it. You get a JVD, right? So that's your first sign. You become hypotensive and you have what? Muffled heart sign. Do you remember this triad? And Beck triad? Yeah, that's what I've given you. JVD, hypotension, muffled heart sound. Decreased breath sound on the left? No. There's no change in your breath sound. Drop of your systolic blood pressure with inspiration. This is pulses paradoxical. Yes. And do you have a wide pulse pressure? No. Your pulse pressure narrow. So when your heart cannot pump anymore and you're becoming hypotensive, your systolic get closer to your diastolic. So you get 90/80 is bad, okay? You want the diastolic and systolic far apart, but if they are closer to each other, that means there's nothing, no pumping going on. Your systolic and diastolic is the same. So there's narrow pulse pressure. You don't get wide pulse pressure. So that is the wrong answer choice. So this is wrong. So it's 1, 2, 3, and 5. 1, 2, 3. 1, 2, 3, and 5. 1, 2, 3, and 5. So that's that one. It's a good question to get you thinking. Sorry. So this is the question I do not want to give you the answer. Select or apply. Which of the following symptoms is paired correctly with the definition the nurse should include in the teaching? I don't define these 2 words because I don't want to give it to that way. And this is teaching new graduate about negative symptoms of schizophrenia. Which of the following is spelled accurately? So you have to know these words. Sometimes they put it there. You have no clue in the psych portion of your test. Alogia. Look at it. Alogia. Thus is not decreased motivation. It's decrease, reduce amount of spoken word. You just don't say too much. So this is wrong. I did not pay. So this is to go here. It's not decrease motivation. Avolition is that decrease motivation. So that's the definition. Avolition is decreased motivation. So this is also wrong. Blunt affect lack of emotion. Yeah, that one is right. A sociality is not reduced pressure. It's lack of social. So this one go here. Lack of social interaction. And anhedonia is pressure. You reduce pleasure stuff. So allogoria, reduce speech, avolition, decrease motivation, is sociality, lack of social, anhedonia is reduced pressure. The only thing that is right is that blunt affect. The 1, 2, 5, and 6 are wrong because they pair wrong. Number 36. Right? What do you think? Select or apply. A nurse is caring for a client prescribed disipramine. Which statement by the client at discharge need intervention? You have to see this medication. It said, I know this. This is a tricyclic antidepressant. What is this major problem? Anticholinergic is a TCA dance. Dermatitis, neurological problem, and cardiac. I will take this medication for my BPH. BPH, their problem emptying. If you take an anticholinergic, it's going to get into trouble. You can't pee anymore. So this is wrong. Okay, this is wrong thing for you to say. So the question says, which client at discharge needs intervention? This is need intervention. I will drink 2 to 3 liters of water a day. Anticholinergic will cause constipation. You don't need intervention. If you drink 2 to 3 liters a day, that will help you. Add a bulky agent. Excellent. You don't need intervention for that. For constipation, I will use sugar-free candy mostly of the day because your mouth is going to dry. Use sugar-free candy. No intervention. I will notify my PCP with new diagnosis of glaucoma. Anticholinergic will worsen glaucoma. Therefore, no intervention. The only thing that need intervention is the one. The medication is bad for BPH, not good for it. The nurse was made aware of 4 clients during change of shift. Who should be seen first? You got to be sharp. Client on sucralfate constipation. Classic side effect of sucralfate constipation. Client on the left side after what? Liver biopsy, right? That's wrong. Liver biopsy, you should be on your right side. Okay, so this patient need to be seen, right? But we got to look at all of it. Client with CHF, now with what? Pink fruity sputum. This patient is having pulmonary edema. So I have somebody who is bleeding. Okay, because if you lay on the left side, you'll be bleeding from the liver biopsy. If you have CHF with the pink fruity sputum, you have pulmonary edema. But if I do thyroidectomy and I'm straddling, I have airway. These words are all part of my B sharp. You should check it, prioritization. It will make it easy. Stridor is an airway sound. Therefore, airway is much more dangerous than pulmonary edema, which is a breathing problem, and then liver biopsy, which is a bleeding problem. So I'm going to see this. This is my number 1 patient I need to see. A nurse is caring for a client who is 12 hours post-op gastric bypass. Okay, I've been bypass 12 hours. The client is what? Pay attention. Diaphoretic, heart rate is 100, complaining of incisional pain, 8 out of 10, and he's splitting. He's like bad. He's like telling you, I'm in severe pain. You give them incentive spirometer, they only pull 250. That's like a baby. What is the next best action? Don't call the pain management. Don't massage them. Don't let them walk. They're splitting. Give them their medication. They are in trouble. Nothing wrong with them. Give them pain medication, everything will calm down. Next question. The next should include which of the following? Select or apply. A nurse is caring for a client with severe leg ulcers and pain after ambulation. Client has not ambulated for what? 4 weeks. The nurse is teaching new graduate how to prevent, you want to prevent pressure ulcers and disused osteoporosis. There's two buzzwords there. I have leg ulcers for 4 weeks. I've not worked for 4 weeks. Now I want to prevent pressure ulcers and what? Disused osteoporosis. You have to pay attention. The word is there for a reason. That means you're getting osteoporosis because you're not moving. You're developing pressure ulcer because you're not moving. What do you want to include in the teaching? Turn the client every 2 hours. Excellent. SCDs will not prevent anything. If you put SCDs in their leg, all it prevents is DVT. It does not prevent what? Pressure ulcer or disused osteoporosis. Give them high calorie diet. Yeah, that will help with the pressure ulcer. Passive range of motion by the patient. Passive means this is people get confused when they say passive range of motion. So passive range of motion, that means the patient is not involved at all. Is the somebody doing it? So the nurse will do passive range of motion. So this is wrong. Passive range of motion by the nurse, by the patient. No, it's the passive range of motion are done by somebody else. The patient is not involved. Resistant exercise. Yeah, this will help with the osteoporosis. Active range of motion by the nurse or physical therapy. No, active range of motion is done by the patient. So I flip them so that I want you to pay attention to the definition. Passive range of motion is performed by somebody else and active by the patient. So active range of motion will be performed by the patient. So 1, 3, and 5 are your right answer. A nurse need to assess the client Bartholian gland. Which position would the nurse place the client for the assessment? This one is sprinkling. This is easy one, but you have to know. This is near the vagina. So what do you want to think? Prone position is not the best. High fall, same position is not. Lithotomy is the best way to get it to that organ. Straightforward, right? This one too. I sprinkled in. If you do this test, you may know it, but it's also thinking. You have to know. Special test the nurse is performing. A nurse assesses the client during intake evaluation for periodic chest pain. The patient is having chest pain, right? The nurse places both palm medial to the shoulder blade, so behind, put it on the client back and ask the client to say 99. Which test do you do? And you ask the patient, so this is the patient, if the patient back and this is the shoulder blade, you pull your hand here and here, like that. Which test, and you let them say 99, keep on repeating it. You're not checking for chest rise, you're not checking for inspiration, you're not checking for muffle sound. All these things can be, these two can be what? Assessed by looking at the patient. You don't need to put your palm in there behind your back. What are you checking is this guy, tactile affirmatives. So this is the problem. Number 42. Which diagnosis and treatment the nurse should anticipate? Classic question you have to know. 2-year-old, buzzword, was brought into the emergency room, 6 days of fever, buzzword, fever is greater than 5 days. Sore throat, right? Decreased oral intake, rash from the neck down. Client has what? Chapped lips, mucositis, yellow discharge from both eyes. Yeah, strawberry tongue. This is the way they said it. but I've condensed it that all you hear is buzzwords ringing in your ear. Large cervical lymphadenopathy, hand and feet edema, mucopollular rash, fever 102, tachy, blood pressure okay, SAT is okay. What do you think? Is this rheumatic fever? Is it scarlet fever? Is it rubella or Kawasaki? The answer is T. Crane. Temperature greater than 5 days. Do you see there? 6 days. Conjunctivitis. Do you see yellow discharge from both eyes? R, rash, right? E, erythematous rash, right? A, adenopathy, right? M, mucositis. Do you see there? Chapped lips. And S, strawberry tongue. This is Kawasaki. This is the way I remember it. T cramps, fever greater than 5 days. All of this can give you fever, rheumatic fever, scarlet fever, rubella, but it does not go past 5. They also can give you some strawberry tongue, but it does not do that. It does not have lymphadenopathy like it does the size of the lymph node. So classic Kawasaki, I need you to pay attention to this presentation. If you go take your test and they don't present it like that, then they cheated. But this is the way they will present Kawasaki. This is what they look. T cream symptoms. Number 43. A nurse assesses a client's lung and heard a what? High pitch, harsh, inspiratory, wheezing, whistling sound over the throat area during inhalation. Did you figure out this buzzword? High pitch, harsh, inspiratory, whistling sound. There's whistling sound over the throat area. Which of these can cause the problem? Asthma causes expiratory, wheezing. This is describing a stridor. Which of these causes stridor? Proof, epiglottitis, choking, and anaphylaxis. So this 2, 3, 4, 5. And the one that causes choking. The classic that you have to know. Number 44. What do you think? Select and apply. This is, I just want to test your brain. Which client per infections control protocol required the nurse to wear surgical mask when caring for the client? Which of these will wear a surgical mask? I have 5 patients. Which of these do I have to wear surgical mask? Answer choice is Spider-Man. Spider-Man, I need to wear a surgical mask. What is Spider-Man? These are droplet precaution. This is droplets. Do you see E there? Adenovirus, you see AN there. Rubella, you see R there. Mumps, you see Spider-Man. You see M there. And parvovirus, you see P here. These are all precaution caused by what? Droplet. So all of this, I need to wear surgical masks when I'm taking care of them. Number 45. Guess what? OB. A G1P0 client is on the postpartum ward after delivery. The caring nurse should expect to fill the uterus at which level 24 hours postpartum. This is content. Okay, the belly button is what? 20 centimeters. The pubic area here is 12 centimeters. After delivery, usually the uterus is above here right away. 24 hours, it should be below, and it start coming down every centimeters every day. So 1 centimeter, it will come down every day. And it will take probably 7 days to be below the pubic area. So this is 24 hours. I should expect it to be below, okay, I'll put it here, below the umbilicus, above the pubic area, but it's closer to the umbilicus. So you'll be just here like that. This is where it's going to be. Test kits, test taking skills, content you have to bring, you have to bring, and you have to bring, and you have to bring back when you study. Okay, this is classic. This is also content. Which cells are diagnostic for this condition? A client was diagnosed with what? Hodgkin lymphoma. Whenever you hear Hodgkin's lymphoma, resting back cells. When you see this in the case form, they give you this resting back cells. Yeah, that's what. Eosinophil allergic reaction. Sickle cell, you know, sickle cell disease. Basal cells are on the skin. Basal cell cancer, basically skin cancer. Resting back cells, classic for Hodgkin lymphoma. This is also straightforward question. These are the easy ones in the which of the following the next should include? Select or apply. And next is teaching new graduate how to assess a client with what? Bars with severe hypoxia. And which part of the body to examine to indicate hypoxia? Rewrite the question. Whenever they give you so many words, I always tell people rewrite it. And I've circled it. I've circled 2 words. Where can I find severe hypoxia? Your nail belt will be blue. Conjunctiva will show that. Earlobe will show that. Your nose bridge will show that. Your toe will be blue. All this will indicate where to look for hypoxia. Number 48. What do you think? 48. Which statement from the client require immediate intervention? Select or apply. And next is teaching a client undergoing external beam radiation for rectal cancer. So you're getting radiation for external. You have to know how to take care of internal radiation, external radiation, and radioactive iodine. And I've done 3, the 2 tests. There's one internal radiation. This one, I put iodine and external radiation. What do you do? What do you test it? I bought loose feeding to wear, okay, so that it does not irritate the skin. So this is good. I don't need to intervene. I will use only approved moisturizer cream to the area. Whatever the doctor tell you to put on it, put on it. So you don't need intervention. Heating pad to the skin, no, it's going to bend that thing. So don't put heating pad on it. Okay, when you put a heating pad, it's going to burn it. Remove the black marking dot on the skin. No, that's the radiation mark. That's where they targeting to give you the radiation. So we need to intervene. I will wear a hat when going out in the sun, yeah, to prevent photosensitivity to burn the area. Wash the area with mild soap and tepid water. Yeah, lukewarm water, not to burn the area. So the only thing that need intervention is 3 and 4. 3 and 4 are the one we need to intervene. This is a management case. Select or apply. Which of the following the next should include in the teaching, right? And this is teaching new graduate about do not resuscitate order for a client with a head injury they received from the physician. So the physician said, do not resuscitate, right? What does that mean? Which of the following the next should include in teaching? Client cannot rescind the order. Yeah, they can rescind it anytime. Order does not need to be renewed each admission. It has to be renewed every time they come in. All treatment care ceased. No, they get all the treatment. The order said, do not resuscitate. So listen to the word. If you need resuscitation, that means emergency, your heart is stopping, that's when we do that. Applicable only for cardiopulmonary resuscitation. Yes, when your heart stop, yeah, I will use it, but otherwise, no. No surgical procedures, no more surgical procedures. No, when you need surgery, we will do it. So only one answer choice, 4. Select or apply. Pick those you're confident. Don't just pick them because there's 5 over there. It's a trap. $50. Select or apply. And this is teaching a client with what? Grave disease. This is what I was talking about. Schedule for radioactive iodine therapy. So they're going to get radioactive iodine. It's different from external radiation. It's different from internal radiation. This one, we're injecting it into you, iodine getting into you. Which of these teaching the nurse should include? You have to know teaching you provide. Radioactive iodine therapy for thyroid. We're just making you radioactive. All your secretion is radioactive. Notify the provider with excessive weight gain. Think about it. You have grave disease. What is the problem? You have too much thyroid hormone. What does it do? It decreases your weight. So you have weight loss. If you have excessive weight gain, that means we've destroyed your thyroid. That will make you what? Hypothyroid. And now you're gaining weight. So I need to know about it so that we can give you some Centroid or levothyroxine. Use effective birth control. Radiation is not good with birth control, with having a baby. So we don't want you to have a baby when you're getting this. Sugar-free gum to help with the dryness of the mouth. Here, we're radiating your neck. Your mouth will dry. Sleep in different room if possible. Yes, you are radioactive. You blast your husband, your room, so don't sleep together. All your secretion are radioactive. Yes. It will take 3 months for maximum effect. Yes, it will take a long time. So these are something you have to know with radioactive iodine therapy. Question 51. Same story, same strategy, select or apply. Which of these the nurse should include in the teaching? The nurse is teaching new graduates about potential causes of hypokalemia. Which one should it include? Keywords, hypokalemia. And what should you worry about? Figure out which of these causes hypokalemia. Addison disease, you know, they have no aldosterone, so their potassium is high. Crohn's disease, a lot of aldosterone, potassium is low. Yes. Hyperaldosteronism is the same as too much aldosterone. Therefore, the potassium is going to be low. Chronic NG tube decompression. If somebody has NG tube in the stomach for a long time, what is going to be happening? Hypokalemic, hyponatremic, metabolic alkalosis. So hypokalemic. This is the problem. Diarrhea. When you have a lot of diarrhea, you're losing a lot of potassium. Potassium here. Albuterol is one of those medications most people don't pay attention to. It causes hypokalemia. That's what we use it. When we use it for high potassium, where potassium is very high, albuterol push potassium inside the cell, causes hypokalemia. Same thing as insulin. Insulin will push potassium inside the cell, causes hypokalemia. When you have alkalosis, think about it. You have a lot of bicarb here and you don't have acid. What your body will do is push acid outside the cell, okay, into the extracellular to balance the bicarb. What will happen? We got to get back the H plus. So your body push potassium inside the cell, and that also causes hypokalemia. So these are all causes of hypokalemia, except number 1. And this is the way you should be analyze the question. You can see that this is straightforward by using content, bunch of content, endocrine content embedded in this question. I intentionally said it that way to keep you guys thinking. So the only thing that you don't need is Addison. Number 52. Select or apply. Same story. Which of the following the nurse should anticipate on assessment? A nurse is caring for a client diagnosed with what? Moderate what? Dehydration. This one is all content. If you have moderate dehydration, what do you see? This is the content you have to know. Mild dehydration, it means you've lost 3 to 55% of your body fluid. That's basically weight. And mostly you have mild symptoms. You have increased test, and then decrease and PO intake. That's all. Moderate, you've lost about 6 to 9% of your body. So that's how much weight, water weight you've lost. And this is where you start to see signs and symptoms. You have skin texture changes, right? And changes, and then you start to see mucous membrane moist. Okay, that's mucous membrane moist. And then patient will start, if the kid, you see the fontanelle, it will be sucking, right? So you have a fontanelle or sucking up. Yeah, that's the way you can see. And this is where you see your heart rate up. You see your heart rate going up. And then your urine output start to drop. This is the moderate dehydration. Okay. In the severe form, you're going to see what? Lethargy. Okay. That's where you see lethargy and hypotension. Hypotension. So which of this is a moderate dehydration? Moderate dehydration, I see what? Skin texture, mucous memory, decreased urine output. You should not see lethargic or hypotension. When you see lethargy, hypotension, dizziness, change in mental status, your capillary refill greater than 3 seconds, that's severe dehydration. And you've lost about greater than 10% of your body water. And therefore, that's a problem. So lethargy and hypotension is off. Tachycardia is true. So 1, 2, 3, and 6 are signs of moderate dehydration. 4 and 5 are severe dehydration. This is content you have to know. Number 53. What do we have here? Which client should be seen first? Be sharp. This, you have to master it. Check my YouTube channel, and you see a bunch of be sharp, how to answer this question. It's straightforward, simple as much as you can do it. The nurse was made aware of the following client at change of shift. Who do you see first? Diabetes and glucose? Yeah, he's hypoglycemic, but you have to hold on to that, right? Close to being hypoglycemic. 60 is not good. Lethargy and confusion after outdoor, yeah, keywords. Lethargy. This is a B sharp. That means it's a neurological problem. That's another B sharp you have to pay attention to. So we have 2 right there. Back pain after cerebral angiogram. This back pain and somebody have cerebral angiogram, they bleeding. So we have 3 B sharp here, right? CHF and pink fluid sputum. If you have CHF and you have pink fluid sputum, you have breathing problem. This is pulmonary edema. Stridor, 1 hour after thyroidectomy, this is an airway. So upon the 5 that you have, the most serious, this is a airway problem. He will lose his airway. Even though pulmonary edema is a big problem, there's air coming in compared to the stridor. Stridor, there's no air coming in. When you're bleeding, you're still getting some air in. When you're lethargic, there's air going in. And of course, when your glucose is low, you have still air going in. All the 5 are on my B sharp. But when you do critical thinking, you think like 5 is your boy. So 5 is the right answer. He's the one I have to see. Even though we have a pulmonary edema, we have a bleeding problem, we have a lethargic patient, and we have hypoglycemic, it's all in the B sharp. And this number 5 is your right answer. Number 54. Which of this is the problem? Which client situation require immediate intervention? And next triage the following client. So who problem we need to intervene right away? Rifampin And the orange yellow saliva, that's what you expect. This is, I don't need to worry about it. It's an expected finding. A client on albuterol, when I give you albuterol, I expect your heart rate to go up. Therefore, I'm good with you. You want allopurinol prescribed trihexyphenidyl. Think about it. This is pharm. You have to watch my mental health pharmacology, and you will see that this is a straightforward question. This is a first generation what antipsychotic. They will develop extrapyramidal side effects. So you give them what anticholinergic to minimize it. So this is fine. And you left with the last one. If you use critical thinking, you got to pick number 4. As a sorbite prescribed the fields. I call them the fields, fields. You have a nitrate, and you taking another nitrate. That's B-sharp moment. You got to intervene. Severe hypotension, and you go into shock. So we got to see number 4. Number 55. Which action by the nurse is best, right? The client is in the pre-op holding, waiting for what? Elective cholecystectomy surgery. The caring nurse saw that the consent form has not been signed. Patient already received preoperative sedative drug, ordered PRN for anxiety. So this is, you just break this in the short form. Patient needs surgery, is in a pre-op holding. Patients are anxious. The nurse gave the patient sedative medication as ordered, as needed for anxiety. Then she realized consent is not signed. What do? Call the surgeon to obtain the consent. Negative. Patient receives sedation. Give the client a consent to sign. You are not responsible for obtaining consent. Cancels the surgery. You have no right to cancel it. Test taking skills. I got to pick number 4. You notify your charge nurse. Chain of command. She's in charge of you. Tell her this is what happened. We have a big situation. Figure it out. Number 4, right answer. Which client situation require immediate intervention? Same thing. The nurse is triaging the following client. Be sharp. You got to master it. That's why I keep on giving you guys back and forth, trying to shake your confidence, but to teach you that no, you got to know these things, right? Keep on coming. Electric-like shooting left facial pain in a trigeminal neuralgia. That's what you expect. Don't worry about it. This electric should not be a problem for you. It's just a buzzword that should not trigger you anything. Headache, photophobia in migraine. That's what I expect in a migraine patient. You're going to have photophobia and headache. Sciatica with shooting pain in the leg. If you have sciatica, I should say what? I should see what? Shooting pain in your leg. Therefore, I got to choose number 4. If you have AFib and you have diffuse abdominal pain, that means you have through a clot. You may have a clot that embolizes into the GI tract and causes ischemia. This is peritonitis. Bad practice. Same thing, infectious disease. Which of the following are indicated when doing wound care for a client? And this is caring for a client with varicella infection and a large left wound. Just break it down, okay? I have a varicella infection, and the patient also have left large wound, and I'm doing wound care for that patient. Infectious disease, you say varicella. What kind of precaution do I need? I need the airborne and sometimes contact. So we can have 2 of them. Then you have a large wound. Large wound is a contact. Therefore, I need to provide airborne precaution and contact precaution. Eye shield for the wound, contact, gown for contact, gloves for contact, surgical mask, no. You need the N95 for the airborne. Eye shield, good. Gloves is good. Sterile gloves, you don't need a sterile gloves. You don't need a surgical mask. You need N95. So that's wrong. Gown is good. Gloves is good. N95 and a surgical mask. Why are you wearing two masks? It's not good. So this is wrong. Eye shield is better. Okay. Gown is good. Gloves is good. And N95. This one does not have eye shield. So the best answer is number 4. That's how you answer this question. 58, a long question, but to teach you something. This is to teach you some drug you have to know. Select all that apply, right? A client with severe acne was prescribed what? You know this medication? You have to know. Isotretinoin. Which of the following requirements the nurse should discuss with the patient before giving the medication to the client? Once again, isotretinoin. This is Accutane for acne. What should the nurse do before giving the medication? This is a vitamin A. We call it vitamin A derivative. It's a bad drug, but it's very good. We use it for acne. It has a lot of side effects. Because of that, it's a teratogenic. You can have birth defect. You have suicide risks. Therefore, these things that I've put there, you have to know is stone cold in case you get this question. You need 2 negative pregnancy tests before starting therapy. Yes, the nurse has to confirm 2 negative pregnancy tests before you start taking the pill. 2 negative pregnancy tests before refill. We don't give you 6 months refill. We give you like 30 days. And every time you come for a refill, yes, you're going to have a pregnancy test twice to make sure it's negative. Need to be on contraception 1 month before therapy. Before even you start therapy, you have to be on birth control for a month, okay? And you also need 1 month after therapy, okay? And you have to sign a consent that you're going to follow this law, this instruction. And then when you develop suicide, it causes a lot of suicide ideation. You got to report it right away. You should not give any blood transfusion. And you need 2 forms of contraception while you're on the medication, the pills and the condom. This, I just give you the content. It's designed to give you content. In case you see this question anywhere, you have to know isotretinoin, Accutane. 59. Same question, different way. Who need to be seen first? Prioritization. A pediatric nurse was made aware of 4 clients. Who does she need to see, right? Client with edema, buzzword, and T-colored urine after strep. This is post-strep nephrotic syndrome. That's what you expect, right? Unless they have hypertension, don't worry about this patient. Edema and T-colored is fine. But when you have hypertension, yeah, it's bad. You have to see that patient. Client with projectile, non-bilious emesis and palpable right epigastric. This is classic for what? Pyloric stenosis. I don't need to see this patient. Client with drooling buzzword and fever with sore throat. This is epiglottitis. Your antenna should be going up right now. A client with sore throat and a backing cough. This is croup. Who is more dangerous? Croup, epiglottitis, pyloric stenosis, and post-strep nephrotic syndrome. You know what to choose. Epiglottitis, that's an airway issue. Number 16. This is my favorite question. A client with history of depression, buzzword, is on what? Fluvoxamine, was admitted after a fall. Client sustained what? Open tip fraction. Patient underwent open reduction in internal fixation and was discharged home on what? Linozolid, an antibiotic, and pain medication, tramadol. You have to recognize those medications. 2 days later, client presented to the emergency room, tachycardia, temperature is high, tachycardia, hypertensive, diaphoretic, tremor, and agitation. What is the diagnosis? What action to take? What parameters to take? This is my favorite question. Like I said, I'm on fluvoxamine. What do you think? Fluvoxamine is an SSRI. You give the patient linozolid. It's an antibiotic that also has serotonin in it. You're taking pain medication, tramadol, serotonin. All of the sudden, everything is up. What do you think is going on? Serotonin, SSRI, and I have another serotonin added. This is not thyroid storm. We do not remove the patient thyroid. This is not malignant hyperthermia because the patient went home before symptoms happened. Malignant hyperthermia symptoms will happen in surgery or in PACU. This is not malignant hyperthermia because we never give the patient antipsychotic. Therefore, it's serotonin syndrome. What is the management of serotonin syndrome? I intentionally said it. You want to cool the patient down. Giving patient IV fluid is the best way to cool them. Stop the offending agent. So fluvoxamine needs to be stopped. You got to block the effect of the fluvoxamine, the serotonin floating. I know you see propranolol will lower, is a beta blocker, okay, will decrease their symptoms, but this is very good for akathisia, the inner feeling of restlessness, and it can be used for patients who have extrapyramidal side effects. So this is not right. You see dantrolene, that will relax the muscle, but it's not effective for serotonin syndrome. This is very good for malignant hyperthermia and neuroleptic malignant syndrome. That's why you have bromocriptine. Bromocriptine and dantrolene are very good. Bromocriptine are very good for malignant hyperthermia and neuroleptic malignant syndrome. Serotonin syndrome, what help is benzodiazepine. It cools them down. It brings their temperature down, their heart rate, everything down. So lorazepam is the answer. IV fluid is the answer. So give them IV fluid and give them lorazepam. Even though the dantrolene can work, it's not effective. Used for neuroleptic malignant syndrome and malignant hyperthermia. Benzodiazepine is the best. What do you monitor? Their lab is not important. They are going to go into seizures. So check for seizures, check their vitals, especially their temperature and their heart rate. So seizures and their heart rate is fine. Dystonia is extrapyramidal side effect. We never give the patient any antipsychotic. So this is a very good question for to show you how they can trick you. I've given you everything, a bunch of content in this question. Okay. Number 61. What do we have? Which of the following the NEST should include in the teaching? A NEST teaching new graduate about peripheral artery disease, PAD. You have to master PAD versus PVD because they're going to confuse you with that. So you have to know how to figure out what they are. Clients should avoid prolonged standing. Dependent position is good for PAD. So don't do that. That's bad teaching. They should stand. They shouldn't avoid it. Clients should join walking program. Yes, when you walk, you ensure more blood flow into the leg. Clients should keep the leg elevated most times. When you elevate the leg, you're going to have pallor. Your leg will be pale. You get into trouble. It's going to hurt. Client will need compression stocking. No. So 1, 3, 4 are for venous problem, and 2 is good. Walking is good. Number 62. Prioritization delegation. Which client will be appropriate for the LPN? A nursing team is made up of RN, LPN, and UAP. When you see this, key test taking skills, that means everybody has to stay in their lane. You cannot help anybody. LPN cannot help a UAP. UAP cannot help RN. When it get delegated to you, you do what you do, your lane. The LPN does MMR most medication, monitoring, the word is monitoring, reinforcing, and special tests, tube feed, gastrostomy. Those are the things they do. Check my YouTube. You see all the way to manage delegation with this MMR most, right? New admission, no. The RN does assessment, evaluation, and teaching for every new assessment and discharge, right? Client waiting for discharge. No, she can't do that. Client with DVT on heparin. This is high risk medication. Client with dysphagia, but what? Gastrostomy, they can do all to feed every stoma. So gastrostomy is a stoma. Stoma, urostomy, ileostomy, nephrostomy, they can do that. So this is number 4. Is for them. Number 63. The nurse should position client in which way? And a new client arrive on the med-surg unit after left thoracentesis. This requires a lot of thinking. It's a position problem. If I puncture your lung on the left side, okay, this is you. I puncture your lung on the left side. Your left side is now weak. I need to give your left side time to heal. If I put this down where I puncture, that side is not going to heal. I should put on the good side. So the right side should be down. So right side is the best way to allow the left side to heal. If you put them on the left side, it's the problem. Upright is not going to help them. Okay, we want the lung to expand. And supine too is not going to. The best position after thoracentesis is the good side down, which is the right side, which is the good side. So that side is down. Select or apply. And then you anticipate which medication from the physician. Think. A nurse is caring for a client who is what? DNR, do not resuscitate, a near death, about to die. The family at bedside are complaining of the rattling. That is the buzzword. Rattling sound when the client breathes. This is what we call rattle death. The rattling death. When the patient is about to die, they start swallowing their saliva and choking on it. And you'll be hearing a sound is very disturbing. It's like they're on morphine, they're about to die, they're taking their last breath and gasping for it. You can't help them. They are terminal, but they keep on choking on their saliva, and they make this sound, really bad sound, excessive secretion. The idea is to stop the secretion. That is what this question about. It's a test-taking strategy, thinking, knowledge, content. It's a very simple question, but this is what he's teaching you. Rattling sound is all from secretion. I need to stop the secretion. What stops secretion? Anticholinergic, right? Atropine, anticholinergic. Scopolamine is anticholinergic. Your corporate is anticholinergic. These two, pilocarpine is cholinergic. You make the secretion worse. Cevimelan is also cholinergic. So 4 and 5 are wrong. 1, 2, 3 are your best choice. Sometimes scopolamine is best. You put it at the back in 7 days, and you don't have to worry about it. This is a good question. 65. Which action by the nurse is appropriate? Select or apply. Okay, select or apply. A nurse is admitting a client with suspected conjunctivitis from the emergency room. What action would you do? You have to know the organism involved. This conjunctivitis is a contact. Therefore, if it's a contact, what do I do? Single-use equipment, excellent. Private room, okay. You have to read the whole thing with door closed. The door does not need to be closed. May, the word is may be closed. That's keyword. Droplet precaution, no. Contact precaution. Nurse wear 95, no. This is not airborne. Nurse wear sterile gloves, no sterile gloves, just regular gloves. I did this to like keep on trapping you, because that's what they're going to do for the exams. So watch for these keywords they put there to distract you, but they are not right answer. Only one answer. Select or apply. Pick those you're confident. You'll be tempted to pick a lot. You don't need sterile gloves for this. So the only one is one answer. Contact precaution. Number 66. Which medication may be worsening the client's symptoms? This is a thinking question. The client follow up to the urology clinic after new prescription for BPH. He has BPH, and we give them new prescription, right? Client report the medication is not working and symptoms has worsened. What? BPH, they have problem initiating and keeping going. And so we need to relax the prostate. The prostate is too big, and then decrease the size of the prostate and give them something that can push the prostate, right? This is what we use, finasteride. Okay, this shrink the prostate. Tarazosin, it relaxes, it's alpha blocker, it relaxes and allows the flow. This is flow mass, you've seen it before. Tamoxifen, this is what helps with that. If you don't even know, you see that, oh, this is This has anticholinergic effect. This is decimipramine. This is SSRI. No, it's a TCA. This is a TCA, and it has anti-cholinergic effect. This is a TCA. It has anti-cholinergic effect. Anticholinergic will worsen your BPH. You can pee. You decrease your urine output. Therefore, this is what is causing the problem. Number 67. What do we have? Select or apply. Which of the following the nurse should include in the teaching? A nurse is teaching a client with what? Anxiety, prescribe aprazolam. What is that? This is benzos. I've given you a downer. Okay? Which of these you should avoid? Don't take any more downer. You see how I break the question? Simple. I have 3 words underlined. SATA, anxiety, aprazolam. And then teaching should be included. Benzo, going down. Alcohol, avoid alcohol. Yes, you should not take it. Avoid cyclobenzoparin. This is Flexeril. It's a down. Avoid valerian root. Yeah, this is what people take for anxiety. And it's a downer too. If you take it, you go more down. St. John's is not for anxiety. These are the things you have to look at. So this is used for depression. Even though we know that St. John's is always bad, it's not for anxiety, it's for depression. Therefore, you should not pick the answer. Grapefruit juice, of course, is always a bad one. So 1, 2, 3, 5 are your answers. Number 68. Which of the following the client was prescribed? The client was prescribed alternative medication for severe BPH. The nurse provided teaching regarding headache, that's the side effect, and bleeding risks with anticoagulation if taken together. Which of the following the nurse should include? Simple. I've been prescribed something for BPH. That's all. It's an alternative medication. And when I take it with anticoagulation and bleed, all you need to know is which one is used for BPH. Ginkgo is not used for BPH. Usually people think it's for memory, right? This is to improve your immune system. This is for your strength of the bone and the joint, basically. Saw palmato is BPH. And St. John is for depression. So the right answer is number 4. You have to know what each one is used for, and then you can answer the question. I have a video talking about all alternative medication. Check my YouTube. Number 69. An incoming nurse received report on a client. Which information the nurse should prioritize? This is simple. Which of this you have to prioritize? When they give you your patient, you walk in, they give it to you. Who do I prioritize? Which information? Their intake and output during the shift, or a new prescription they've got, or list of resolved client issue, or their physical assessment. It's no blame. The way they look is the most important. If they're sick, yeah, it's the one I have to prioritize. It's not how much fluid they got, how much new prescription they have, issue that is being resolved. No, it's their physical assessment. Next question. What is the best action by the nurse? The client is in the postpartum ward. 24-hour local assessment reveal red and fresh odor. What is the best action? You have to know after delivery what the local look like, whether it's red, whether it's yellow, whether it's turning into white, it's changing color, whether it's smelling, whether it's bloody. Of course, 24 hours, if you have red loci, that's not normal. If it look freshy, yeah, that's the debris coming out. But if it has bad odor on it, yeah, fishy oil or fishy odor, but freshy odor is normal. Notify the provider immediately. You don't need to. That's normal finding. Suspect infection is not infection. You call the normal finding. You don't need to palpate the uterus. This is normal. If you don't know how to answer this question, check the stages of the loci and you can see. This is a good question just to get you guys thinking. Sometimes they give you straightforward, but this is something you already know. I don't want you to give you the straightforward one. A nurse should anticipate which of the following assessment. The client echocardiogram, that means we check their heart function, show a left ventricular ejection fraction of 20% and S3. This is your heart, okay? And this is the left ventricle. And we see how much blood coming out. Only 20% is coming out. Usually most people are like, we want it to be 45 and above. So you have less than normal people. 20% is being coming out. That means most of the blood is staying there. And now you have S3 gallop. What do you think? S3 and low ejection fraction, it means left heart failure, basically. You have left heart failure. Instead of telling you have left heart failure, I give you this thing so that you can connect it together. Clinical thinking, critical thinking, thinking about the issue, right? Left heart failure. What do you see in the left heart failure? Low output, right? So low urine output. You see mostly lung symptoms, crackle of the lung base, right? Central venous pressure of 25. This is the right heart failure. Okay. JVD, right heart failure. You have increased abdominal girth, right heart failure. Weight gain, right heart failure. So the only two answers that you have is what? Which one do you think? Which one do I expect to see in left heart failure, low urine output, and a crackle on the lung base? Okay. Number 72. And let's calculate the breathing score for a client on admission and recorded sex, the normal sex. Okay, the normal sex. What is the next interpretation? This is straightforward. If you know, you know it. If you don't, the breathing score, you can get up to like 14 or 15. Maximum, the higher the normal, the less risk of what? Sacral or pressure ulcer. Okay, if your normal is low, your pressure risk is very high. Anything below 8 is bad. Okay, you want something higher, 13, 14, right? It's normal. So this patient has higher risk. There's no low to moderate. It's high risk problem. High risk of having sacral pressure ulcer. Number 73. Which member of the interdisciplinary team should be most involved in the care of this client? Interdisciplinary team. A nurse is caring for a client with what? Dysphagia due to recent surgery. Who do you call? Dysphagia? Physical therapy? No way. Occupational therapy, they would do anything below the wrist. Speech, yeah, they will do swallow steady, and they can recommend specific food you need before the nutritionist come in. It's not the nutritionist. The nutritionist deal with the type of food. But if you have dysphagia, talk to the speech pathologist. Very, very good people. Number 75. 74. Which client behavior is consistent with this phase, right? Which client behavior is consistent with this phase? You have to know this, right? The client is in the postpartum ward after delivery. The nurse suspect that the client is in the taking old phase. After you deliver, you are in the taking old. There's 3 phases, okay? There's a take in, okay, which usually occur from birth to 48 hours. And this is where the mommy is self-centered, right? Always care about herself. Then take old, now it's trying to take care of the babies between 2 10 days, right? And they start to learn to care for the baby. Then the last one is letting go. Now they have let go everything. Their emotion is all gone. It's after more than 10 days. And what they do is they adapt into situation. So adapting to everything. Therefore, we talking about taking hold, we are not adapting. It's not 12 days. 12 days is letting go. And learning to care for the patient is the best one. Self-centered is taking in. So number 3 is the right answer. Number 75. Which assessment should be performed last? And next is assessing a 6-month-old at the ped clinic. Which one would you perform last? When you're doing newborn exams, I call it let LFT Moro. That means these are the stages. So first one is you look. So exams that require looking. The second one, L, which is you have to listen something. F, you got to feel. Okay. And then the T, you touching. You feeling a little bit, but the T, now you just doing the bigger one, big test that require more palpation, basically. And M is Moro. That means Moro is the last test, the most aggressive test. That means you start from the less invasive to the most invasive. Observing is not that bad. A hard sound, you listening. Palpating, yeah. And then E, eye check, is more invasive than palpating. And then when you're doing Monroe, it's more expensive. Basically, it requires a lot of the kid does not like it. You just drop in the kid and you feel like they're going to fall. Yeah, that's Monroe test. It's more, if you do that from the beginning, they start crying, you can't do any of your tests anymore. The idea is to do the least invasive test so that you can get to your invasive test. If you start with your invasive test, you get into trouble. So the last one will be the Monroe test. It's the most invasive. That's the idea. 76. Which of the following the nurse should include? What? A nurse is teaching new graduate the elements necessary to prove negligence. So negligence, we got to prove negligence. This is very important. You got to listen carefully. To improve negligence is just you did something that is not standard of care, not standard of care. So you fail to implement like a fall precaution for a patient that is at risk of falling. If you do that, you're being negligent. You're not instituting the things that you're supposed to do. So that's negligence. So how did they prove that? Your duty to provide standard of care. You fail to provide standard of care, right? This is select or apply. You breach after you breach the duty and failure to meet that standard. And after you do that, you know you can foresee that a harm is going to happen to the patient, and you never did that. And you breach of the duty after you breach that duty with potential to cause the harm to the patient. It has caused harm to the patient, and the harm occurred. So these are what they will start saying. They are all lawyery words. So you have a duty to provide standard of care. You have breached that because you never provided that. You know, you foresee that if you don't do that, it's going to happen to the patient. Something bad is going to happen to the patient. And there is the possibility of potential harm to happen. And the harm occur. I need to institute fall precaution. I never instituted. Patient is at risk of fall. Patient fell and break his leg. This is our lawyer staff. That's all the 5 things you have to include as a breach of to prove negligence. Number 77. Which of the following are component of colostrum? A nurse is teaching new mother 1 day postpartum to breastfeed the baby to ensure benefit from colostrum. Which one are the component of that? The reason why we want you to feed them right away is because of this. They get some vitamins in it. There's antibodies in it. There's growth factors they can grow. There's protein, and then a lot of protein, lactoferrin, involving iron. So these are all 5 factors They got it. So that's why it's good to breastfeed your baby the first few days. 78. SATA. Which of the following indicate correct delegation principle by the nurse to RPN when caring for a client with pneumonia? Okay, for a nursing team of RN, RPN, UPN. I already told you, you have to stay in your lane. RPN does what? MMR most. Assist client with ambulation. She does not do that. This is a UAPA job. Reinforcing, the word is reinforcing. Teaching, yes. Position the client in the follow position. No, they don't position. That's a UAP job. Check for tactile frivolous. This is a special test. They can do that. Record incentives, perimeter, effort, and reading. No, they are not UAP, so they don't do that. So 2 and 4 are what they can do. Number 79. Which teaching the nurse should include? Select or apply. G1, P1, just at the baby. Postpartum client, ask the nurse about breastfeeding and breast milk storage principle. These are short. If you know it, you know. If you don't know, which teaching the nurse should include? What are the principles for breast milk? You can keep it in room temperature for 5 hours. I call them the rule of 5. The rule of 5 for breast milk. Room temperature for 5 hours, 5 days in the refrigerator, 5 months in the freezer, and at least 12 months. 12 months in the deep freezer. 5 years is too much. So 1, 2, 3 is your right answer. So number 80. Which of these the nurse should consider as the possible cause? Select or apply. The postpartum client developed delayed postpartum hemorrhage. Which one is the test taking skills? Look at it. Delay, that means later before they start bleeding. If you have episiotomy, yeah, you're going to bleed right away there. If there's laceration in your perineum, you're going to bleed, right? There's no way you're going to have delayed bleeding. If I cut your uterus, C-section, you're going to bleed right away. But you have urine sub-involution. It does not involate completely. So this is the uterus after baby is delivered. You want the uterus to be like that, completely contracted. If it's like this sub-involution, yeah, it's going to bleed. If there's still product there, retained product of conception, you bleed. When you have infection, you bleed. Sometimes things you don't know, look at the words, and go back and say postpartum bleed, hemorrhage, delay. Well, the first 3 are something that happened right away. And the last 3 are not. So test taking strategy. 81. This is straightforward. If you know, you know. Breastfeeding client is 5 weeks postpartum. Which type of breast milk is predominant? Which one do you see predominant at this stage? You have to know. When you get pregnant, sometimes second, third trimester, from second, third trimester all the way to 5 days postpartum, you have colostrum. Then from 5 days to like 5 weeks, you have the transition milk. Then 5 weeks to several years, you have the mature milk. The fall milk is the milk that just happened when you start breastfeeding your baby. And they always say the hind milk is the best one, the rich one. That's why they say feed your baby for at least 15, 20 minutes because they will get the hind milk, which is the last drop that comes out. It tastes so good for the baby. So that one is not part of the stages, but these are the stages. And for 5 weeks, we are in what? A transition zone. So this is transition milk. Number 82. What is the best action the charge nurse should take? A nursing team is made up of RN, RPN, and UPN. UAP. UAP is not performing tasks delegated. The nurse reported the issue to the nursing manager. What do you think the nursing manager would do? You are in a team, UAP is not doing the job, and you came and reported. You have to take care of your team. Go back and deal with your team. Insists the UAP performed. She's not going to do that. Meet all the nurses. No, the nurses are not the problem. It's one nurse and the UAP. Let them deal with it. Ask the nurse to talk to the UAP. Yes, talk to them. You are the boss. Talk to them. Reassign the UAP. You're not helping the situation. So 3 is the right answer. Normal 83, calculation case. This is a calculation and it's a burn case, right? I want to teach you something here. How much fluid rate the nurse will give the first 8 hours? The 40-year-old client sustained burn from what? Boiling oil. Injuries include a superficial burn, anterior posterior torso, posterior left arm, and the partial thickness, anterior posterior left leg, and posterior right leg. Look, when they give you a burn question, watch for the word superficial. As soon as I see superficial, I would say all this is 0. So superficial burn is 0. Don't include it. Just use partial thickness and full thickness. So for this patient who has what? Burn to what? Anterior posterior left leg. If this is the left, this is the right, this one. So here you have 9, 9. And then posterior right leg, we have 9. So we have 27 total body surface area. And then times the patient weight. Patient weight is 154.2 pounds. You divide it by 2.2, which will give you kilos, and 70 kilos. You convert it to kilos. So you have 70 here times what? 4 cc ml. And this will give you close to 756 ml total. You have to divide this by 2. This will be giving the first 8 hours, and the other will be giving the first 16 hours. So the first 8 hours, and this divided by this is 3780. So 3780 divided by 8 hours will give you 472.5 ml every hour. And so this is the right answer, 472.5 ml every hour. If you want to know how much is the rate for 18, the next 16, you just divide this over the 16. If they just ask you for the fluid, yeah, it will be 378. This is the right answer. If you need more, just email me or check my adapter and place, and you'll find some more examples. A nurse is caring for a client with the EKG strip show below. Which description by the nurse is accurate? What do you think? I know this is not sinus. This is not normal sinus rhythm. This is not AFib. This is chaotic rhythm. It's irregular. This is what? AFib. So irregular test taking skills. I see irregular here. I cancel here. Do I see any P waves? They said no P wave good, no P wave good. Then do I see the QRS? Look at the QRS. Is this less than 120 seconds? That means 3 to 5 boxes? No, it's more than that. Therefore, this is your right answer. Excellent. And here, even it's wrong. It told you many P. This is PR, many P. There's no PR here. There's no P here. This said no P. This is many P. So the right answer is number 4. Number 85, and the last one. A nurse is carrying nurse should palpate which abdominal region to assess the client pain. Where would you palpate? A 65-year-old with severe constipation and a lack of fiber, no fiber in diet, and prior diagnosis of what? Diverticulosis, present to the emergency room with what? Abdominal pain, fever, and decrease oral intake. So we have a patient who has fever, decreased oral intake, and then a pain, and he has history of diverticulosis. What do you think? He has to have acute diverticulitis. Where would he be? Here. So this is where you pipette to elicit the pain. This is the end of it. 85 question. I yield fact, straightforward question, critical thinking to get you thinking. This is Adapt NCLEX for you. There's 3 series. Check them out. Hope you enjoyed. Subscribe if you don't subscribe. Check the link down and then you click your notification on. If you do, you get more content like this. All the best of luck. Take care of yourself. Keep charging as always. Adapt NCLEX to get you back. All the best of luck. Bye-bye.